we're now going to have the final speakers for this event. So Lauriane Bender, who's the Open Science Project Manager at the Health Data Hub, and Isabelle Blanc, who's the National Chief Data Officer at the Ministry responsible for higher education and research. They're going to talk about the challenges linked to opening and sharing data linked to research, particularly in health.
Agathe pour l'introduction. J'espère que vous avez tous
Thank you very much, Agathe, for this information. I hope you've enjoyed the presentations that have highlighted all of the data challenge events that Agathe has been leading over the last couple of years within the Health Data Hub. I just want to talk us about the different data challenges that were presented today. There have been a lot of diversity in the speakers and the issues. We've focused on teeth, on allergology, on anatocytopathology. There's a real broad range of interest, and it shows how interested data scientists can be in analyzing health data. The Data Challenge project has been part of the Health Data Hub's Open Science approach, and we've got 4 people working full-time on these issues. I got on the Data Challenge and 3 other people on other issues. This open science approach is part of the government's policy that was introduced a bit more than 2 years ago. It started with the Botterell mission. The Botterell is named after the member of the French Parliament who had led it, and the idea was to highlight issues in France around open data and open source algorithms, and how to make general interest data available. With Stephanie Combe, head of the Health Data Hub, we were able to be part of that mission. Since then, the French has put in place posts for administrating data and algorithms. Isabelle's going to tell you a little bit more about that. She does that role within the Ministry of Research, and the different ministries are working on making available their algorithms and source data. This is a broad government initiative that doesn't just affect health data. The significance of this project is to facilitate the reuse of data, because often it takes many years of data management in order to put in place a research project. But as you know, international research doesn't necessarily have years to spare. So this is why the Health Data Hub has put in place all of these initiatives in order to facilitate access to data. We've got a number of different projects within Health Data Hub, particularly around the data challenges. We've got another area of work which is to facilitate people and their understanding of the health database. It's all the data around reimbursements that have been carried out by the French health insurance system. We've also got it's an extremely complex and sophisticated database that can be used by researchers. So we've got a whole field of work around documenting this database and making algorithms available, and to connect to different stakeholders who are working on this and publishing articles. And on the 29th of June, we're going to be organizing an event here in Paris Health Campus, either here in this room or above, in order to present the prize winners of the people involved in the BOAS project, the open source library of validated algorithms. The idea of this is to make available to the community algorithms that help to identify certain populations that have certain pathologies. This is based on the Health Insurance Administrative Database, the SNDS, but it's going to be broadened out to include other cohorts in the future. More broadly, this strategy is not just something that's put in place by the Health Data Hub. The entire French healthcare ecosystem has the same open science approach. We work with the French national health insurance system. We work with the INSERM organization, also the RedSiam network, who are a group of experts in open science. So I want to thank them for all their work on a day-to-day basis. There is also a lot going on in terms of awareness raising with other partners, supporting projects that are going to be funded by the Health Data Hub, because we are starting to work on our algorithms with the Implicity startup. They were mentioned at the start of this meeting. The data is often research data, and that's why we wanted Isabelle to talk just a little bit about the ministry's approach to the use of research data. Thank you very much. Thank you for this invitation. I'm not going to speak for long in order to conclude this meeting, but as was said, people talked about this Botterell mission, which highlighted a number of key points around data availability. Open science is an initiative that's been ongoing for about 10 years or more. Opening up research data is something that has been the case in astronomy for maybe 50 or 60 years, for environmental sciences for a while as well. So the French Ministry of Higher Education, Research and Innovation put in place a plan for open science, the first one in 2018 and another second plan that was published last July. In this plan, the link with everything that was shared with this afternoon is that you've got a chapter focusing on research and the way that we can support the French research community in order to structure and open up its data. We're not just talking about sharing data on an entirely free of charge way. We are talking about sharing and our key focus is to try to develop a more community approach to science with much more transparency. So thank you to all of you who have been presenting the data challenges. You're highlighting the need to have data that can be reused by other people, however this data is shared. So what does this plan present? It commits the research community to boost the reuse of research data, so preparing data to create together databases, data sets to enable the broader science community to address new research questions or questions like those that you've highlighted today. Your work is not just about theoretical research. There are issues around improving therapeutic care that you've presented. So we want to encourage these practices and support them through supporting the community. We want to recognize through awards and prizes exemplary practices, and particularly practices around preparing data for their reuse. This is often very time consuming and an invisible piece of work that is carried out by colleagues who are not often mentioned in the bylines and headlines of the publications. Our role within the ministry is to open the way for participation in certain Europe-wide calls for proposals on reusing research data in order to have this data used even more widely to enable new approaches and new piece of work on this type of work on major research questions. So thank you very much for all of these initiatives. Congratulations. The more we promote them and highlight them, the more we will prime the pump of creating large data sets and finding new approaches to different questions on health data or other types of data. very much, Lauriane and Isabelle. We haven't really planned for lots of Q&A at the end of this conclusion, but if there are any extra questions, we can take them. Thank you very much. I think there is a question from the floor from Antoine Roux. Thank you. I'm very delighted to hear that you are thinking about incentivizing these open science projects. Here, I think you've got a non-representative sample of the ecosystem. I think within our ecosystem, we'll need to convince them and draw them into using this type of system. And the current financing system for research doesn't really work like that. That's the first comment. Yes, also the evaluation systems, said Isabelle Blanc. My second comment is that the previous data challenge was all about open science from the start to the start to finish, but the winner refused to accept the prize because they didn't want to publish their algorithm. So we've understood, I think it was said in the first presentation, that particular challenge was going to make it obligatory for all competitors to publish their algorithms publicly. That's one of the key tensions in the scientific community. How do you see this in terms of the sharing of data? The only thing we can do is to incentivize things. There is a legislative framework. There's a law on public administration and data. Whenever we're within public administrations, there is a legal framework that speaks about the way this data can be used. I'm not talking about specific things in this type of research. I can only talk in very broad and general terms. I think we could have a very long discussion around this subject. So yes, bear in mind that I'm talking very generally here. So you've got this legal framework which does exist, and we can see that it still isn't sufficient because since 2007, you have often any project that's funded by the EU to more than 50% has to have an open data approach, but we're seeing that it's still difficult to put in place this principle of sharing between different stakeholders. So I think we need to focus on other areas. We need to focus on the individual and collective evaluation of research. This is something that's still being looked at, really, because the system is still based on the recognition of research papers and an indexing system. What we've been working on, particularly through the DORA declaration that's been signed by a number of institutions, and particularly since February this year, there's been a European and international consortium focusing on changing the individual and collective evaluation criteria in order to recognize the diversity of different reviews in which texts are published in, and also to recognize open source codes, open source algorithms, and the opening up of research data. And that's a key thing that's lacking in evaluation. There was a bit of a discrepancy between what we were advocating and what we were evaluating. So we need to assess research, and we need to evaluate not just quantity, but quality. Some French funding agencies are starting to do that, and more are coming on board over the last few months to ensure that the criteria used to evaluate a project take into account these aspects around open science. In the most recent European calls for projects, this was cited as a criteria of excellence. It was previously only considered to be a technical criteria. Here are a few things that can be used beyond incentivizing it, but there's a lot still to do. But I think the key is evaluation and funding. Thank you very much. Thank you once again to Isabelle and Lauriane for their concluding comments. We just want to take advantage of this opportunity to announce that the Ministerial Delegation for e-Health, the French Investment Bank BPI and the Health Data Hub are pleased to announce a new call for projects in 2022. So we are saying that if you want to ask us any questions about this new data challenge project, please contact us on the email address that you see on the screen. So once again, we want to select health-related data challenge projects, provide support from start to end, and these projects will also be funded by the French Investment Bank BPI and through the DNS. If you've been interested in the challenges presented today, if you're interested in specific ones, do scan this QR code and you've got a whole list of the different challenges. You can select the challenge that you're interested in and you will get signed up to a newsletter where you'll receive all the information about the challenge. So any time any news about each challenge comes out, you'll get the latest information, and particularly the information about the launch dates for each challenge.